This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is Menkes disease? Answer: Menkes disease is an X-linked recessive connective tissue disease caused by impaired copper absorption and transport due to defective Menkes protein ATP7A. Question: what is the difference between Menkes disease and Wilson disease? Answer: the difference between Menkes disease and Wilson disease is that Menkes disease is caused by defective Menkes protein ATP7A, while Wilson disease is caused by defective ATP7B. Question: how does Menkes disease affect collagen cross-linking? Answer: Menkes disease leads to decreased activity of lysyl oxidase, which leads to defective collagen cross-linking. Question: what are some symptoms of Menkes disease? Answer: symptoms of Menkes disease include brittle, kinky hair, growth and developmental delay, hypotonia, and an increased risk of cerebral aneurysms. Question: how Menkes disease is caused? Answer: Menkes disease is caused by a genetic mutation in the ATP7A gene, which encodes for a protein that is responsible for transporting copper in the body. Question: what are the main characteristics of Menkes disease? Answer: Menkes disease is characterized by the impaired copper absorption and transport, which leads to decreased activity of enzymes that require copper as a cofactor, such as lysyl oxidase. This leads to defective collagen cross-linking, resulting in brittle, kinky hair, growth and developmental delay, hypotonia, and an increased risk of cerebral aneurysms. Question: how Menkes disease is treated? Answer: treatment of Menkes disease involves the administration of copper supplements, and enzyme replacement therapy has been attempted with some success. Question: what is the prognosis of Menkes disease? Answer: the prognosis of Menkes disease is poor, with the majority of affected infants dying before the age of 3. Those who survive may have developmental delays and other long-term complications. Question: is Menkes disease a common condition? Answer: Menkes disease is a rare genetic disorder with an estimated incidence of 1 in 250,000 live births. Question: how is Menkes disease diagnosed? Answer: Menkes disease is diagnosed based on clinical presentation, genetic testing, and laboratory tests that measure copper and ceruloplasmin levels in the blood. Question: are there any preventive measures for Menkes disease? Answer: since Menkes disease is a genetic disorder, there are no preventive measures that can be taken. However, early diagnosis and treatment can improve the outcome for affected individuals. Question: are there any specific genetic counseling available for Menkes disease? Answer: yes, genetic counseling is available for families who have a child with Menkes disease or who are at risk of having a child with the disorder. Genetic counselors can provide information about the inheritance pattern, the chances of having another affected child, and the available options for prenatal diagnosis and carrier testing.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.